Hello, my dear subscribers. Today, we are talking about how to walk correctly if you have osteoarthritis and which muscles you should pay special attention to if you have osteoarthritis and enjoy walking. These are exactly the questions you ask me most often, and today I will gladly share everything I know with you. Before we begin, I want to give you a sincere recommendation from the heart. Please do not neglect sunlight during the winter. If the weather is nice and sunny, put aside your household tasks and go outside for at least a short walk in the sun. Sunlight is vitamin D. It strengthens our bones and supports our immune system. In fact, it affects everything from the tips of our fingers to the top of our head. Our beauty and our health are deeply connected to sunlight and vitamin D. So whenever you see the sun, especially in winter, go outside and enjoy it. Now, let's talk about osteoarthritis and proper walking. The first thing I want to say is that whether you have osteoarthritis or not, there is something called a walking pattern. A walking pattern consists of several phases. When we take a step, we land on the heel, then the foot is fully on the ground, and finally we push off with the toes. If you have osteoarthritis, it is especially important to check whether all these phases are present when you walk. If you are not sure, take a camera or your phone, record yourself from the side while walking, and carefully observe your movement. There are two main problems that often appear in walking when osteoarthritis develops. More precisely, there are two common deformations. The first one is excessive outward rotation of the feet. Over time, a person with osteoarthritis may begin to turn the feet outward too much in order to compensate for pain. A slight outward rotation is normal, but strongly twisting the foot outward is not recommended. The second problem is compensation through the hips. Instead of lifting the leg upward during a normal step, a person begins to swing the hip to the side. This often happens either because of pain or because the quadriceps muscle is weak. As a result, the walking pattern becomes what is commonly called a waddling or duck-like gait, where the hips move side to side instead of the leg lifting naturally.
Now let's talk about which muscles need special attention if you have osteoarthritis and enjoy walking. There are 4 key muscle groups. The first and most important group is the gluteal muscles. These muscles are extremely important. When I walk, I consciously feel my gluteal muscles working. I can feel them contracting and relaxing with every step. Try a simple test. The next time you walk, either outside or at home, ask yourself whether you can feel your gluteal muscles working. If you do not feel them and you have osteoarthritis of the knees or hips, this is not a good sign. It means that your gluteal muscles are not supporting your body properly, and all the load is being transferred directly to your knees and hips. The first thing you need to do is activate your gluteal muscles. A simple exercise is to stand still and squeeze your glutes. Hold the contraction briefly, then relax. If this is difficult, sit upright on a chair and alternately squeeze one glute, then the other. I call this exercise the glute dance. If you still have trouble feeling the muscles, place your feet firmly on the floor and gently press them down. This will help you activate the glutes. Repeat this exercise many times until the muscles start responding. The second important muscle is the quadriceps muscle of the thigh. The majority of knee and hip joint problems are connected to weakness in this muscle. The main exercise to strengthen the quadriceps is the squat. Stand with your feet hip-width apart, push your hips back, and lower yourself slowly. The movement should be controlled. If this feels easy, perform the squat very slowly, lowering yourself gradually and holding the position before standing up again. The third muscle group includes the hip stabilizers. These muscles help keep your body in proper alignment and prevent excessive side-to-side movement of the hips while walking. Strengthening these muscles is important for everyone, especially for people who enjoy long walks. Exercises for the hip stabilizers include lifting the leg upward, moving the leg out to the side while standing, and the clam exercise performed while lying on your side. Using an elastic resistance band can make these exercises even more effective. The fourth muscle group, which many people forget about, is the calf muscles. These muscles play a very important role in walking. A simple exercise for the calves is rising up onto the toes. Lift yourself up slowly, hold briefly, and then lower yourself back down in a controlled manner. This can be done on both feet or on one foot, always focusing on slow and careful movement. We have now reviewed all the main muscle groups and discussed proper walking technique. If you still have questions, please write them in the comments. If you found these recommendations useful and practical, please support the video.
Thank you for watching. Take care of your joints, stay active in a smart way, and I will see you in the next videos.